We've always been told that in some shape or form, structure is related to function. Structure is also a way through which things can be identified. We recognize objects by sight and instantly know their use. On a microscopic level, a biologist may study a cell and know its role in the human body based on its features alone. Similarly, a chemist may study a molecule and know how it interacts with other compounds based on its structure. These are just some of the reasons why scientists always strive to understand and characterize the structure of all things. In the pharmaceutical industry, this is especially important, as even the slightest change in a drug's structure can lead to dramatic effects. Think back to stories you may have heard about the morning sickness drug, thalidomide. A slight change in the drug's conformation led to birth defects in over 10,000 babies. This was a minute structural difference that led to a large functional change. Thus, it is very important to characterize all pharmaceuticals. But in the pill form of a drug, there are many components. There are binders and fillers and other compounds known as excipients, and then there's the active pharmaceutical ingredient, API for short. And this is the part of the drug that leads to the necessary effect on the human body. The problem with current techniques is that it is very difficult to distinguish the signal from the API from that of all the other excipients. Take aspirin, for example. A pill from a bottle labeled 325 milligrams weighs significantly more than this. But what this means is that 325 milligrams are acetylsalicylic acid, the active ingredient, whereas the rest of the mass is made up of the binders and fillers and other excipients. So think of the problem as trying to find a spoonful of salt buried somewhere in a sandbox. My name is Natan Veinberg, and I work in Dr. Shirko's research group, where we employ solid-state nuclear magnetic resonance as a solution to this problem. We study hydrochloride active pharmaceutical ingredients, which comprise 50% of all solid pharmaceuticals. The presence of the chlorine atom in these pharmaceuticals gives us a direct probe into characterizing and determining the structure of these pharmaceuticals, unhindered by the presence of the excipients. My project aims to further develop the use of solid-state nuclear magnetic resonance for the characterization and structural determination of these APIs through the use of the 35-chlorine isotope. By studying several different hydrated hydrochloride active pharmaceutical ingredients, I hope to better relate the structure to the spectrum in hydrated forms of these drugs. This project will hopefully aid the pharmaceutical industry in developing new and improved methods of drug screening and drug analysis. Because remember, the first step of studying a drug's function is to study the drug's structure. Thank you.